Hello and welcome to another segment of Ask a PT. I'm Austin Kercheville with Excel Rehab and Sports at our North Shore location. The question today is physical therapy important after a lateral ankle sprain? So ankle sprains are really common injuries that just about every athlete has had at one point or another. Usually, a small ankle sprain can be managed with your typical RICE treatment, rest, ice, compression, and elevation. This can help calm the inflammation down and help decrease pain after a minor ankle sprain. But any more significant ankle sprains can actually leave people with lasting deficits, either in range of motion, in strength, and in their balance and reaction time with that ankle. So it's very common that I see people end up having recurrent ankle sprains because even though the ankle itself has healed, you haven't restored your full range of motion and your full strength and neuromuscular control of that ankle. So then you get back into game type situations where you're focused on playing and you cut at some point in time and then you roll the ankle again. Typically, this isn't necessarily because the ligaments in your ankle are stretched out, but rather because the mechanics of your ankle are off with loss of range of motion, or because your brain is not controlling that ankle well anymore, and it's you have decreased neuromuscular control, decreased reaction time. So that's why PT is often very important for an ankle sprain to decrease your risk of re-injury and of continued disability due to an ankle sprain.